I'm finding it hilarious that the patients I have who voted for Trump and applauded the big, beautiful bill are the same ones who are losing their Medicare and Medicaid coverage. It's ironic.
I did vote for Donald Trump. I was completely wrong.
I was wondering if you could just start off by telling me a little bit about, what your health situation and your insurance situation currently looks like. How much is that cost going up by?
That'll be $1,500 a month.
Oh, whoa.
So something that we cannot afford. Our premium next year, if the Affordable Care Act continues, will be $174 and something, around $175.
If the tax credits get renewed, but the $1,500 a month is if they don't get renewed?
Right.
I mean, how would that increase affect you? I mean,
well, we would lose coverage. My husband does concrete work, so during the winter, we barely make it. My husband has problems with both of his knees. He's got no cartilage left on them. We consulted two specialists. They both have said that he cannot have surgery at this moment. We've consulted a doctor in Mexico also. They will do the surgery for $6,000 each knee. If it was to be that situation where he really needs it and we don't have insurance, Mexico will be the best option for us.
Pivoting a little bit to people in power who have kind of made this the reality. Your vote last November, I'm wondering if we could go back in time to then.
Right, I did vote for Donald Trump. I am usually a Democrat. I've always voted Democrat. I guess the way things were going, I said, well, here's the best option for this. I was completely wrong. I don't know who they're favoring or who they're benefiting, but it's not us.
What made you want to vote for Donald Trump last November?
I guess the way the economy was heading, but then again, I was wrong about that too. Prices keep rising. Wages stay the same. We have 5 kids. It gets hard to provide everything for them. It's not fair because at the end, we all contribute to this country.
Big, beautiful bill, Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
It's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're going to lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that for you, for her. Now, thank God that she has successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house, you're going to lose your home, you're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're going to need it. For you, it's probably going to be a couple years, all right? Because I could tell you've probably been eating butter and fried chicken for the last 20 years.
They thought they were voting to hurt others, but now the pain is knocking on their door. Many MAGA voters, they cheered cuts to government programs, are believing that welfare only help Black and brown communities. They celebrated policies meant to hurt immigrants, low-income families, but now the reality is setting in that they voted again is their own interest. Well, racism is expensive and choices have consequences. Let's have a look.
So the health insurance marketplace just opened today here in Oklahoma. And I just went and looked up my current plan. And it's going up by 160%. I can't afford that. We knew this was coming. I don't know why I'm surprised. It was just shocking to see it in black and white. 160%. So I knew this was very likely, but I'm not going to have health care next year. I'm 57, I'm healthy, but all I can afford is the catastrophic care. This is the richest country in the world. But my government doesn't care about me. My government doesn't care about my health care.
Y'all are seriously falling for this? Like, seriously? You are being manipulated into not caring that people are losing health insurance. MAGA was taking heat for Medicaid cuts, so they quickly pivoted, flipped the script, and said, no, we're not cutting Medicaid. We're just kicking those undeserving and lazy people off of Medicaid. Your lack of understanding about the U.S. immigration system and healthcare system is being exploited, and MAGA is trying to convince you that some people deserve healthcare while others do not. Immigrants without full lawful status are already not eligible for federal Medicaid, and the only reason some states have expanded their state health insurance programs to include these folks is because it's cheaper. It's cheaper to insure people than to not insure them. And these immigrants, regardless of their documentation status, are contributing to our communities. They are building our economy. They are paying taxes. There is no amount of creative math that can be done that only kicks undocumented people off of Medicaid and gets us to $800 billion worth of cuts. It's not possible. On the moral front, everyone deserves health care. On the financial front, bad health care will always be more expensive than good health care. And no one can make an economic argument that kicking people off of health insurance is going to save us money, because it won't. It is going to cost all of us way more money in the long run.
Well, I think people are starting to see Medicaid. I've seen, I don't know, maybe 10 videos this morning. These poor people. They've lost their Medicaid. And at least the people in these videos, they don't have a pension. They don't have savings. Their Medicaid is what is paying for their medication. Predominantly. And they can't afford it. There was one gentleman that is on 23, I think he said, medications. Some basically, in his words, to sustain his life. And he can't afford them. And as I listened to these videos, I thought, God, like, how did we get here? That we are now taking benefits away from people. How did we get here? How did people vote for this? There were a couple Republicans on these videos, and they seemed absolutely shocked that they suddenly didn't have Medicaid. It was kind of like, we thought Democrats were lying, and now we know they weren't. And just the vibe was, they were shocked. They were absolutely shocked. The others were Democrats, and they knew what was coming down the pipeline, didn't expect it so fast, I think. And how do you have time to prepare for something, even if you know that it's coming, when you don't have the funds? They don't have the funds. And I feel so bad for these people. There's just, I don't have it in me to kind of go, at least in this moment, to go, like, we told you so. I've had moments of that, but we told you. But you listen to the guy that's on the list. instead. It's heartbreaking. This one gentleman had to choose what he could afford, and he could only afford 7 of his 23 medications. Now, if you're in your 60s or older and you're on certain medications, normally, they're medications you absolutely need. So like thyroid, maybe, high blood pressure would be one. Your insulin. So, and there's a long list. You guys can chime in with the other things that require consistent medicine. This is medicine.
Call me crazy, but the big beautiful bill is the consequences of the actions of the lower class by voting for Donald Trump in droves. This is the part that I will never understand. Republican policies always target lower class families and middle class families. They never uplift them. And they constantly vote against their own interests. If you were holding out for like Lisa Murkowski to vote against this bill, let's be honest, Lisa Murkowski and Susan Collins are 2 of the sternest eyebrow furrowers in the Senate, but they always fall in line eventually. It's always political theater in an attempt to get some kind of thing that they want, which they rarely ever do. Ultimately, this bill will be disastrous for lower class families, both through the Medicaid cuts that will kick a lot of those people off of their insurance coverage, but it will also destroy rural hospital systems. It will make it harder to get health care in America. And all of this is being justified for tax cuts for billionaires and more money going to ICE because the Republican Party is still trying to convince this country that the immigrants are the reason they don't have money and not the billionaires.
Wendy, the MAGA lady, puts out, I voted for President Numbnuts to piss off liberals. It was really funny. I'm now worried that I may lose my Medicaid now. I have type 2 diabetes and diabetic retinopathy. If I lose my health care, I won't be able to afford my meds and I will lose my vision. I'm in tears. Please help. You're in the find out stage of your fuck around. Thoughts and prayers.
We don't want to hear shit when you lose your Medicaid. We don't want to hear shit when you lose your SNAP. We don't want to hear shit from those states when FEMA doesn't show up for your tornadoes, hurricanes, and floods this year. We don't want to hear shit when you figure out that those tax breaks are not for you, but they're for the rich. We don't want to hear shit when you figure out that no tax on tips and overtime ain't even real. We don't want to hear shit when you figure out that he is increasing the debt ceiling by trillions of dollars, which is going to cost us a lot. Because we try to tell you. So you're excited about this bill passing? Just remember when all that shit happens to you to not open your fucking mouth.
So what I'm seeing from all these videos that I've been making about losing my Medicaid is that even 11 years later, MAGA folks are still super upset about the ACA. I'm sorry, MAGA folks on private insurance. They really do look at it as like a zero-sum game. Which is wild to me because if we had a single payer system, everything would be so much cheaper. But everyone wants to pay more money. They want to do it the dumb way. And they want to do it the dumb way because they want to make sure that they can exclude the people who they don't think are like morally deserving. It's wild to me how significant a portion of our society believes that if you don't have what you need, they think it's your fault. They don't see the system problems. My decision to leave EMS in healthcare has been totally validated because especially after COVID and now this, I don't think I could give those people compassionate care. I don't have the strength of character. They are committed to cutting off their nose to spite their own face.
Do you MAGA nurses, I can't believe that's a fucking demographic that exists, but do you MAGA nurses not realize that if these Medicaid cuts come through, you're gonna lose your job? Like, nursing homes and rural hospitals and mental health facilities, those places are gonna shut down. You're not gonna have a job. Like nursing, which has always been this safety net, like, oh, I can always find a job anywhere, it's gonna completely ruin it. Like, I know you don't care about poor people or elderly or disabled, but have some fucking self-preservation. Your cult is so embarrassing.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical. How is this fair? How does this work for anybody? I can literally cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying. When in the fuck is this nation supposed to be great again? Because it's getting worse.
You see, for years, millions of Americans were convinced that government welfare was mostly helping other people. They were told stories that poor black families were abusing welfare. They were told immigrants were draining the system and taking their tax dollars. And because of that messaging, many became comfortable supporting cuts as long as they believed the pain would land somewhere else. But when Medicaid is cut, it affects a white family in a rural town as much as a black family in the city. When Medicare is cut, it affects white elderly people just as much as anyone, you know? When rural hospitals close because of funding, the people suffering the most are often the ones who voted for these politicians. And this is a tragedy of division politics. It convinces people to vote against their own interest in exchange for the emotional reward of feeling superior to someone else. And to be honest, this has happened throughout history. Powerful politicians, they often redirect economic pain from themselves towards minorities, you know? Instead of asking why wages are low, why healthcare is expensive, why housing is unaffordable, and why corporations are getting tax breaks, you know? They encourage people to blame immigrants, black communities, or poor people. It is a distraction strategy because if working class white, black, or even brown people united around healthcare, fair wages, affordable housing, and dignity for all, then those in power would be forced to answer real questions. So division becomes a tool here, and many fought for it. And some voters thought, I may struggle, but at least those people will suffer more. And that mindset is poison because when cruelty becomes your political compass, you stop asking whether a policy helps your family, and you only ask whether it hurts someone you dislike. And that's how people cheer for policies that themselves they rely on. But now many are realizing, too late, that Medicaid helped disabled children, struggling workers, elderly parents in the nursing homes, rural hospitals, and low-income families of every race, you know? They are now learning that Medicare protections matter when the bill rise. They are now discovering that slogans do not pay medical bills. This is why racism is very costly. It costs communities, hospitals, families, healthcare, and worker solidarity. And the lesson here is that politics based on revenge eventually harms the people are demanding revenge. You cannot build a healthy society based on cruelty, and you cannot improve your own future by celebrating someone else's suffering. So thank you so much for tuning in. Be sure to like, subscribe, and share. Have a good one. I'll see you in the next video.